Hello, I'm Dr. Ryan Kazemi, an oral and maxillofacial surgeon here in Bethesda, Maryland. Now, dental implants are considered a predictable and long-term tooth replacement solution as long as there is sufficient bone and gum tissue, and also if the implant is perfectly placed and restored with a proper crown. However, inflammation can occur for various reasons, which can lead to bone and soft tissue loss and ultimately compromise of the dental implant. This is a condition that is known as Peri-Implantitis. Early Peri-Implantitis can be treatable. However, in more advanced cases, implant removal may be the most predictable treatment option. So if you want to learn more about this condition, what causes it, and how its risks can be minimized, please check out my ebook called The Painful Dental Implant, which you can download for free on our website. Now let me share with you a patient who presented with Peri-Implantitis. This patient had successfully placed and restored a dental implant years ago, and for reasons that were unknown, it developed Peri-Implantitis and gradual loss of bone. The implant and the tooth was meticulously maintained by her dentist, and the patient practiced excellent home care. However, the bone around the dental implant continued to deteriorate. And this is because the biofilm or the toxins that sit on the implant surface are extremely difficult to remove and clean. And here we can see the x-ray showing about 50% of bone loss around the dental implant. Now, in order to better assess the implant position and its relationship to the maxillary sinus, which is right above it, a cone beam CT scan is done, which confirmed the bone loss and also showed that there was a safe distance from the sinus with about 1 millimeter of bone remaining at its tip. So the treatment that was recommended was to remove the crown and the implant, debride and clean the site, and then perform a minor bone graft to restore the ridge and replace with a new dental implant at a later time. So first, the screw that was retaining the crown is removed and the crown is taken off. And here, when we examine it, it shows a deep pocket in the area around the implant where the bone loss had occurred. Since we're going to need to graft the area, a very conservative flap is created in order to access the implant. We can now clearly see the chronic inflammatory tissue around the implant along with the bone loss. For implant removal, I'm going to use a reverse torque technique, which requires no bone cutting or removal. So here, we're going to place a special device that engages into the implant. And then, using a torque wrench, it is loaded in a reverse direction, causing the separation of the bond between the implant and the bone, which is then simply reversed and removed. The inflammatory tissues are then completely removed, and the site is irrigated to clean. We can see the intact bone here below the sinus cavity with no perforation. Now, we'll use some bone particulate material which has been mixed with platelet-rich fibrin derived from patient's own blood, and we graft the site fully. We'll then cover the graft material with a special collagen occlusive material that will contain the graft and protect it during the healing. We also place a platelet-rich fibrin membrane, which is tucked in the tissue, and it really helps with the gingival healing and maturation. And the gum is then sutured in order to support the graft. We'll allow this to heal for about 4 months before replacement with a new dental implant. So remember that dental implant complications can be managed quite effectively with very conservative techniques and relatively rapid recovery. So if you have any questions or you would like to consult with us to help you with your implant complications, please let us know. Thank you.